My name is Carl Hinson. I'm the Director of Workforce Development for Hawaii Pacific Health. Hawaii Pacific Health is a healthcare organization. We're the largest private employer in the state of Hawaii. We have 4 hospitals, 70 different locations throughout the state. We have clinics on every island in the state. We're here at our Harbor Court offices where Hawaii Pacific Health is a little bit different than some organizations. We have what we call a shared service. So we look at all of our different hospitals and all of our facilities, and what you'll find here in our corporate office is all of our human resources functions, all of our IT functions, accounting and patient billing. So we've taken all of that and we've consolidated it, and so that we're getting economies of scale, so to speak, and at our facilities then is where all of the care is provided, and all the administrative functions are here in our central facility. In 2001, when the merger occurred, which was the merger of Kapiolani, Wilcox, and Straub, that occurred in 2001. Part of the framers of that merger said, hey, we have opportunities here. We don't need all of the HR. We don't need all of the IT. Are there ways that we can bring this all together? And so that's how it came into being. And so over time, the human resources has gotten to the point where it needs to be to support this size of an organization, and that's true of IT as well, and of course all of our accounting and business services. So it's a way to be able to provide for a lot of different facilities. So you can see there was a lot of cost savings on the part at the merger because we were able to consolidate those services and then spread that over a larger group. Whether it's patient care or it's the non-patient care areas, end of the day, we're looking for people that are service-oriented. You hear people, it's really funny, people say, well, healthcare's not for everybody. Well, if you don't want to be a nurse and you don't want to be a doctor, that's fine. But that doesn't mean that healthcare's not for everybody. I mean, we have a wide range of other clinical professionals, administrative support. We just got done talking about IT and HR and the business services, but healthcare is for everybody. We have every job occupation that you can think of available here. We have plumbers, we have electricians, we have engineers. All have to still come together to deliver the same service that we provide to all of our patients. So at the end of the day, it's what kind of people are we looking for? It's people that know their trade, know their occupation, but have that passion for service, patient service, customer service. We're like the hotels in that we still have a lot of the same services that you can find in a hotel, but at the end of the day, ours is about caring for the patients. And so it's a little different take, but at the end of the day, it's still a great occupation, providing a great service, and you get great rewards in the end, too. What I share at orientation with our new hires and with our recruiters, we're looking for people that are passionate about providing the best service that we can provide. We do that in many ways. You look at human resources, we're providing the best service to all of our employees who are then providing the care to all of our patients. So we're only 1 or 2 degrees removed from the person who's providing that care. So it's about, be passionate about what it is you want to do. Go out, get your education, get your training, your vocational training, be good at what you do, and then come to us, and then we'll help you with the rest of your development and keep you on a career pathway. If you want to grow and go on to other things, whether it's in the clinical world or in the administrative world, we have those options available. But it's all about being passionate about what you want to do, care about what you want to do, and be passionate about making sure that our patients get the best outcome possible. If you go into an occupation, you should understand what's required to be successful in that occupation. And in healthcare, being successful means that you're taking care of that patient, or you're providing the level of service necessary to make sure our patients are getting the outcomes they deserve. Be passionate about. I say to my staff and anybody that will listen to me, be passionate about what you're going to do. It can't just be about a paycheck. If it's about getting a paycheck, then there are many other occupations, many other jobs you can do, but be passionate and be happy about the the career path you've chosen. And if you're happy, that leads to, you know, financial happiness, family happiness, spiritual happiness. I mean, everything evolved. Work is such a big part of all of our lives. Why just do something to collect a paycheck? I mean, life is short, so why be miserable that whole time? Find something that you can be happy with, that you're passionate about, that you can go home at the end of the day and say, wow, I did something, or I was involved in this, or the patient had this outcome and I was a part of that. That's cool. Go home, sleep well, get up the next day, and be ready to do it again. Check it out first. We have, every healthcare organization in the state provides opportunities for students or individuals to come in and shadow. So you think you want to be a radiologic technician, okay? See if you can't go in and shadow somebody for 8 hours. Watch and see what a rad tech does in a day, and see if that's something that would be of interest to you. We provide an internship program every summer for 75 high school and college students. They come in, they spend 6 weeks. We're fortunate enough that we're actually able to pay them for the internship. So they're getting compensated, it's a summer job. But what they do is they get exposed to all different areas of the healthcare organization, both administrative and clinical, and it gives them that opportunity to see, is this something that would be right for me? Because as we said earlier, some people think that healthcare is not for everybody, and on the clinical side, that's true. But my point is healthcare is for everybody, because we've got administrative side, we've got the clinical side, and so if you have an opportunity to come in, it then becomes about, is this the type of organization or is this the type of industry I can work in? Because some of the other advice I would give is you need to make sure that if you're looking at a healthcare organization, recognize what it's like to work in that organization or in the industry. For example, being on time for work is crucially important in healthcare. You don't show up on time for work, it has consequences to patients. Or maybe there's another nurse or another nurse aide that has to stay longer because you were late. So we talk about soft skills. I like to tell people at orientation that in a lot of ways it's stuff that we call common sense, but if it's never been taught to you before, then it's not very common. And so you hear it for the first time. It's about make sure that you're dressing appropriately, make sure that you're on time for work. We have no issues whatsoever with you expressing your individuality with tattoos and piercings just after work. But when you come to work, you cover tattoos because you're dealing with patients from all walks of life. And in some cultures, the tattoos are appropriate, and in others, they're offensive. And so in healthcare, we tend to go the conservative route. You cover all tattoos, you make sure that all your piercings are covered or removed, and in what you do after hours, we support you. So. I started off in healthcare as a clinical provider. I started out before I was even of legal age. I was an EMT, and then I became a paramedic. Went into the Navy as a physician assistant, and I was caring for patients one at a time. And then I got sidetracked nicely into human resources and the whole idea of recruiting. And so for me it was, I got this great charge out of taking care of every patient. And so when I got done, to me that was satisfaction. I thought that was really great. But now that I'm helping to hire all of the people who are caring for all of our patients, I'm getting an even greater sense of satisfaction. So to me, what I love about this job is I'm having an effect on all of the patients that are being cared for, because myself and our team are responsible for hiring all the people that are taking care of our patients. So, you know, at the end of the day, I said that several times, but at the end of the day, I'm a clinical provider, but I'm not providing direct care anymore, but I have a hand in it because we're helping to bring all these people in that are doing it. That's cool. We don't, in the state of Hawaii, produce all of the occupations, the professions that we need. And so the challenge that we find is we have to go to the mainland a lot to hire clinical professionals, administrative professionals, to come and meet our staffing needs. As much as we would like to think that we can train and educate everybody in every occupation that we need, we can't. We're a small state. We only have so much academic capacity. We do send our keiki off to the mainland in large numbers to go off to college and get the skills and the training they need, and then we try to bring them home. The challenge is you tend to take a job around where you train. I think I read a recent statistic that said 75% of people end up getting a job within, a 50-mile radius of where they did their training. And so if we're sending a lot of our children to the mainland, they're staying. And so they're not all coming back. We're not training enough. So that's the hardest part. And it's more expensive when you're recruiting from the mainland. So if you're here, you're not going to the mainland, look at the community colleges that we do have, look at the trades that we do offer here, and look at healthcare. Like I said earlier, healthcare is for everyone because we employ so many different occupations. There is such a severe shortage of medical assistants in this state. Heald College, the whole thing with Corinthian College, they shut down. That took out 180 spots per year of our training capacity. Hasn't been replaced. And so, it's our public institutions, it's UH, it's Kapiolani Community College, Kauai Community College. Those are all great institutions, but it's the for-profits too that are providing the training and that we really need. And Hawaii Medical College, the other one is Medical Assist School of Hawaii. They're putting out great graduates. They're providing great education, they're providing great students, and providing us with excellent employees. All of our academic partners play a crucial role in healthcare continuing to move forward. And as we look at our aging population, not only in Hawaii but across the country, healthcare is going to continue to be in demand. The occupations are going to continue to be in very high demand. As our population ages, you and I are going to need more health care. We're going to need more people to take care of us. And so as much as we encourage our academic partners, both in the public and in the private sector, they can't do it all. And so we encourage them to add more capacity, to add more occupations. We partner with them. I met yesterday with the Dean of the School of Nursing at UH Manoa, and again, we have those discussions about what can they do as an educational institution to continue to support us as a healthcare industry and make sure that, we're in alignment. And I think, we have those discussions with all of our educational partners, and it's important. And in a state the size of Hawaii, it's even more important than perhaps some people on the mainland would look at their educational partners. I think in Hawaii we're positioned very well for most of what we're hearing is happening or could change. I think as an organization, as a state, we're fairly well situated. Nationwide, there's a lot of uncertainty. I think you have different markets that have gambled and gone one direction, and depending on what changes, healthcare could go in a completely different direction. And so that's causing some real concern, obviously, across the country. I think the other challenge that we're facing is we have a growing population of people approaching or going beyond age 60. And it's a challenge. You hear everyone talking about wellness and trying to keep everybody healthy and active. And those are buzzwords, and those are things that some people think doesn't mean anything. But what the true meaning is the more active you are, the healthier lifestyle that you lead, the less health care you're going to need as you age. And so that's purposeful, because as our population ages and we get this much larger population, typically as we age, we need more health care. So if we can do things now to keep ourselves healthier, we won't need as much health care in our advancing years. We're going to need health care, but if that can help stem some of the tide, maybe our workforce demands won't be as extreme as we're projecting. So the direction of healthcare, that's more of a political discussion, and where it ends up, it ends up. The aging population is a real thing. Shortages in certain occupations, that's real. And so we've got to continue to look at how we change the model of care. You've got a lot of direction now in team-based care, where you've got teams of people that are caring for patients rather than an individual provider, as a way to make sure we're covering all bases and keeping people out of the hospital, and homelessness, working on homelessness. And so those are the challenges that are facing, not only here in Hawaii, but nationwide. Globally, yeah, I mean, it's an even greater problem in so many countries. And there are other countries that have different models than we have that will swear by their model of healthcare. And some of that has been tried in the United States. Some of it's been successful and adopted, and others haven't. But in the United States, the biggest challenge probably is the aging population, and trying to do the best we can to keep all of us healthier longer, so that we don't utilize as much healthcare, which will help with the workforce challenges.